Mr. Camp.
Thank you, Mr. Speaker. I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Louisiana, Dr. Boustany.
Gentleman from Louisiana is recognized for 2 minutes.
Thank you, Mr. Speaker. As a physician with over 30 years experience, clinical experience, taking care of patients as a cardiac surgeon, I'm certainly familiar with the problems in our healthcare system, and there's no denying we need to do substantive reforms. But, Mr. Speaker, this law has not created the kind of reforms that are needed for our healthcare system. Let's talk about seniors for a moment. This law cuts over $500 billion out of the Medicare program. It's going to hurt seniors. I know this from my own personal experience, having dealt with seniors and seniors' health care. We have not fixed the mismatch between cost and reimbursement. This is leading to accelerating access problems for seniors and others to good, high-quality health care and a good doctor-patient relationship. It's going to force seniors to travel further, to wait longer, depriving them of regular access to a physician that they know and trust. We haven't solved the problem of portability. Portability is something Americans cared about. Owning your own health insurance and carrying it wherever you go. We have ways of dealing with that. That has not been solved with this law. Taxes. Nearly $800 billion now in new taxes, and the total keeps growing. 21 new taxes on every aspect of the American economy. There's no wonder this economy is in the doldrums. There's no wonder we have 41 quarters of unemployment exceeding 8%. This is unacceptable. Another 800,000 jobs at risk, as my colleague mentioned earlier. Plus, the CBO reports that the health insurance tax, something that hasn't been talked about much on small businesses, will be passed through to the consumers in the form of higher premiums for private coverage. Experts also warn that the law will cause massive disruptions in how medicine's practiced. It will accelerate the demise of the independent practice of medicine, which is a threat to the doctor-patient relationship, creating all kinds of conflicts of interest, from a bureaucratic board telling physicians what to do to all these other bureaucratic entities between the doctor and patient.
An additional 30 seconds.
Gentleman is recognized for an additional 30 seconds.
This one-size-fits-all approach is a disaster, and that's why we must repeal this bill in the name of quality, in the name of cost, and in the name of getting this economy back on track. I yield back. Thank you, Mr. Speaker.